Approximately 23 million pregnancies worldwide end in miscarriage each year. This represents about 15% of all known pregnancies. This equates to roughly 44 miscarriages occurring every minute. However, the actual number may be higher, as many miscarriages occur at home and go unreported. Despite how common it is, the topic of miscarriage is still considered taboo. This often results in isolation and emotional trauma for those affected. The stigma and myths surrounding miscarriage can result in self-blame and a feeling of guilt. However, many miscarriages are unpreventable and beyond the individual's control. Miscarriage is more common than most realize, a deeply personal yet surprisingly widespread experience. It's a topic often shrouded in silence, but its impact resonates across families and communities worldwide. In fact, about 1 in 4 recognized pregnancies ends this way, highlighting just how prevalent this issue is. This statistic underscores the importance of understanding and addressing the needs of those affected by pregnancy loss. This equates to totaling over 23 million miscarriages each year worldwide. These numbers paint a stark picture of the global scale of pregnancy loss, affecting individuals from all walks of life, across different cultures and socioeconomic backgrounds. Despite these numbers, silence and stigma persist, creating a barrier to open discussion and support. This silence can amplify feelings of isolation and shame, making it even harder for individuals to cope with their loss. This often leaves many to grieve alone without the support and understanding they deserve. The absence of open dialogue can prevent individuals from seeking help and processing their emotions in a healthy way. This lack of open conversation fuels myths and isolation, perpetuating misconceptions and preventing individuals from accessing accurate information and support networks, ultimately making the emotional burden even heavier for those already struggling with profound loss. The weight of silence adds to the pain, hindering the healing process. Many experience grief, a deep and complex emotion that can manifest in various ways, alongside confusion and self-blame, which can further complicate the grieving process. It's important to acknowledge that these feelings are valid and that seeking support is a sign of strength, not weakness. Often feeling as if they've failed, despite the fact that miscarriage is rarely, if ever, the result of something they did or didn't do. But miscarriage is not a personal failing. It's crucial to remember this. It's a natural, if painful, part of the reproductive process, often resulting from chromosomal abnormalities or other factors beyond anyone's control. For every 3 fertilized eggs, only 1 typically results in a live birth, a statistic that highlights the inherent challenges of early pregnancy. And many losses happen before pregnancy is even detected, meaning the actual number of pregnancies ending in miscarriage is likely even higher than reported. Breaking the silence helps normalize the experience, creating a safe space for individuals to share their stories and connect with others who understand, and validates the grief, acknowledging the profound impact of pregnancy loss and allowing individuals to feel seen and heard in their pain. Open conversation dispels myths, replacing misinformation with accurate knowledge and empowering individuals to make informed decisions about their health and well-being, and reminds people they're not alone, fostering a sense of community and providing a supportive network for those navigating the challenges of pregnancy loss. By understanding the true scope and causes of miscarriage, we can better address the needs of those affected and work towards reducing the stigma surrounding pregnancy loss. Ultimately, we can offer compassion and support to those affected, creating a more understanding and supportive society for individuals and families experiencing this profound loss. Pregnancy begins with a complex interplay of hormones. Estrogen thickens the uterine lining, and after ovulation, progesterone prepares it for implantation. If fertilization occurs, the embryo produces HCG, the hormone detected by pregnancy tests, which signals the body to maintain the pregnancy. This delicate hormonal balance is crucial. Any disruption can prevent the pregnancy from continuing. Up to 1/3 of fertilized eggs never implant, often passing unnoticed as a slightly late period. The journey from fertilization to a positive test is filled with biological checkpoints. Even at this earliest stage, pregnancy is a remarkable, fragile process. When miscarriage happens, it's a deeply personal and often isolating experience. People often search for reasons, seeking answers and explanations in the wake of such a loss. The internet can be a source of information, but also misinformation. This quest for understanding can sometimes lead to misplaced guilt, with individuals unfairly blaming themselves. It's important to remember that most miscarriages, especially those occurring in the first trimester, are due to random chromosomal abnormalities, errors in the genetic blueprint that occurs during conception. These are errors in cell division that no one can control. They are simply a part of the natural biological process. Everyday activities such as stress, which is a normal part of life, exercise, sex, or even travel, these common aspects of daily life do not cause miscarriage. It's crucial to separate fact from fiction and dispel these common misconceptions. Myths about vaccines, often fueled by misinformation, birth control pills taken before pregnancy, or morning sickness during pregnancy, only add unnecessary guilt and anxiety to an already difficult time. Less commonly, underlying medical conditions or uterine issues may play a role in miscarriage, but even in these cases, these are not caused by personal actions or choices. The body's response in these situations is often protective, a natural mechanism, ending pregnancies that, unfortunately, cannot develop healthily. Miscarriage is fundamentally a biological event governed by complex processes, not a reflection of your health, your worth as a person, or your future ability to carry a pregnancy to term. Understanding this crucial distinction can help release the burden of blame and self-reproach and support the process of emotional healing and recovery. The physical experience of miscarriage varies. Some discover it only during an ultrasound, while others notice symptoms like bleeding and cramping. As hormone levels drop, the body sheds the uterine lining, often with heavier bleeding and stronger cramps than a typical period. The process can last from hours to weeks, depending on the stage of pregnancy. It's physically and emotionally draining, and uncertainty about when it will end can be difficult. Anyone experiencing these symptoms should contact a healthcare provider to ensure safety and rule out complications. Medical guidance is essential for reassurance and proper care. Understanding what's happening physically can help people navigate this challenging time. When a miscarriage is confirmed through examination and testing, understanding the available paths forward is essential. There are 3 main management options to consider. Expectant management, which involves letting the body pass the tissue naturally, medication, utilizing pharmaceutical intervention, or a minor surgical procedure performed by a healthcare professional. Expectant management allows nature to take its course, providing the body time to resolve the miscarriage on its own. However, this process can be unpredictable in terms of both timing and the duration of bleeding, and can sometimes be lengthy. Medication, most commonly a combination of mifepristone followed by misoprostol, helps the body expel the tissue in a more predictable time frame and is often managed at home under the guidance of a healthcare provider. Surgical management, which includes procedures like vacuum aspiration or dilation and curettage, D and C, is a quick and effective option and is usually performed in a clinic or hospital setting. Each option presents its own set of benefits and drawbacks. The most suitable choice depends on individual medical history, the stage of the pregnancy, and personal preferences and values. A healthcare provider can offer personalized guidance and support to help navigate this decision-making process. The most important thing is that people are fully informed about all available options, empowering them to make the best choice for their individual circumstances. Empowering informed choice supports both physical and emotional healing during this challenging time. Access to miscarriage care isn't always straightforward. Medications and procedures are the same as those used for abortion, creating barriers in places with legal restrictions. In such regions, fear of prosecution can prevent people from seeking life-saving care. Untreated miscarriage can lead to severe bleeding or infection, making timely medical attention critical. Over half the world lacks reliable access to essential reproductive health care, putting millions at risk. Miscarriage is common and unpreventable. It's not anyone's fault. Everyone deserves safe, compassionate care and support. Open conversation and advocacy can help break the silence and improve access. No one should have to face miscarriage alone. If you or someone you know has experienced miscarriage, remember, you are not alone. Reach out for support, share your story, and help break the silence. Together, we can foster understanding and compassion. For more resources and support, visit trusted organizations or speak with a healthcare professional.